watching the India Development Debate. I'm Tamanna Inamdar and we're tracking the coronavirus pandemic right here on the show. It's the biggest story in the country, it's the biggest story in the world, and it's tearing through global markets and Indian markets. The Dow Jones opened about 5% down, still about 5 to 6% down, even as the US government pump primes its economy, promises everything, including giving every American $1,000 each just to ensure that the economy stays up. It's not just the US, countries across the world are doing exactly the same, trying to ensure that the pandemic, apart from destroying the health and the public health system of its people, doesn't destroy economies in its wake as everything shuts down. In fact, Canada just earlier this evening announced fiscal measures and help equivalent to 3% of their GDP, which is why it's time to ask, what exactly is India doing? What exactly is our plan over here, and is it now time for us to pull out all stops to ensure that the economy doesn't take a plunge? Of course, as always on the show, we will also focus on what is happening with our efforts to control the disease, and that discussion will come up ahead with top medical experts. These are the best names you can get, so please watch out for that. But first up, we're tackling India's economic response, because remember, we are in lockdown mode. Just earlier today in Parliament, officially the government has admitted that the hit to the travel, tourism and hospitality industry is about 5 lakh crore rupees. This is only going to increase as you see small businesses around you shutting down, malls, restaurants, pubs, etc. closing down. A lot of offices are asking their staff to stay at home. There is going to be a hit. There is going to be a lot of people who are daily wage laborers who earn their money every day or who don't have secure jobs, who are going to take a hit on wages. So what's our plan? What should be our plan? To talk about this evening, I'm joined by Dr. Arvind Virmani, who's Chairman for Foundation for Economic Growth and Welfare, Dr. Pranab Sen, a former member of the Planning Commission of India, and Dr. Sachidanand Shukla, Chief Economist at Mahindra & Mahindra. Welcome to all of you, and thank you for joining us on the live show this evening. Mr. Virmani, let me begin by just getting your thoughts on some of the things we've said. We don't know what's happening next. The future is uncertain. India's strategy so far seems to be to try and be ahead of the curve in the disease actually spreading. So we're doing social distancing, we're shutting down schools, colleges, malls, etc. But what about the economic impact of this shutting down?
So there are really two important dimensions we have to keep in mind, and one background. The background is very simple. We were already in a growth recession, and I had said before the pandemic that we were kind of at the bottom of the U. Now, since the pandemic has happened, that is become questionable, that there is a possibility now clearly of going even further down. That's the first thing. Second, what the effect of the pandemic will depend critically on the length, its length, which could stretch from 3 months to 18 months. And when I say length, kind of the critical point for each economy, and in our case also, is the point at which it reaches a peak and clearly starts to decline. So that's kind of a critical point, and if that critical point is reached well within the 3 months, the effects clearly will be shorter and easier to contain. And the third point is that in this kind of a crisis, the quality of the response, the government response is very, very critical. In most normal times, you do a little bit, you get a little bit of a bump up, or you do a little badly, you get a little bump down. But in a crisis, the quality of both the kind of policies and how they are implemented and how quickly it is done becomes very, very important. So the hit will really depend on these last two factors.
Yeah. While we continue with this discussion, I want to quickly check in on how US has opened, and I have Jeff Dennis with me on the phone line, independent emerging markets commentator. Jeff, thank you so much for joining us on the show this evening India time. What really is going on through your mind right now? The US government seems to be throwing all it has at the pandemic. What is the thought process right now in the markets? And we're seeing the Dow Jones not really responding.
Well, I think first of all, you're getting above all just continuing volatility here. Huge decline Monday, nice rally yesterday, big decline today. Again, although obviously it's early days in the market. I think what's happening is the market is beginning to work out now how serious this pandemic is going to be for the economy, let alone the health, the health consequences. I mean, I live in one of the counties in California that is basically under lockdown now, and it's astonishing to see how different the place feels like it did just a few days ago. And I think the market's reflecting that, and the worry in the markets is sort of reflecting that. So I think it's no surprise, therefore, that having seen the Fed basically fire the big bazooka with interest rates now at zero and buying commercial paper and doing a big chunk of new QE, that now the fiscal measures are going to get rolled out. And I think that's absolutely the right thing to do. One of the interesting things I think that's going on is there is some suggestion now for the first time for a very long time, you're getting bipartisan agreement on the measures on this particular subject after, several years, frankly, of partisanship. So I think people in Washington are waking up to how serious this is and the impact on the economy. And I can go into more detail if you want, but that's what's going on. This part of California where I live is essentially shutting down. And if you write that large across a lot of California, a lot of the East Coast, New York, New Jersey, Connecticut, etc., other parts of the country, the hit to the economy in Q2 is going to be enormous. And I think that's what the markets are beginning to worry about.
Yeah, Jeff, that's actually quite reflective of the fear as well. As large cities go into lockdown mode as much as possible, and small businesses need to shut down as well. So just your view on how things are looking in terms of the Indian perspective, because the American government seems to be very aggressively trying to mitigate these issues, whether it's the economic impact for small businesses or whether it's, $1,000 to every American and measures like that they're rolling out. How are you looking at what we're doing over here and how markets over here would react to what could be very similar concerns?
Well, I think what's interesting is how weak the Indian market is, even though your incidence, obviously, of the coronavirus is quite low still at this point. Now, I think there's probably a couple of explanations for that. One, the inevitable fear that maybe the coronavirus will eventually land in land in India in a more serious way. But also, you're getting this spike now in the dollar, which is hitting. It's not a big spike, but you're getting clearly a move into the dollar, which again is very typical of a recessionary environment, which is hitting emerging market currencies, and obviously is hitting the Indian rupee quite significantly. But I wonder whether there's sort of the sense that India's not getting hit that badly by the virus, and so the government, unless I've missed something here, is not doing much about it because there's nothing to do, so to speak, with respect to the virus. And maybe people are concerned that all that is still yet to come. I mean, you've heard my view before on this. I think India is always a little bit of a safe haven against a lot of this stuff globally. You have got the benefit of lower oil prices, but I suspect the market is very concerned about what happens when the virus gets to India, if it does, and the spread of it, and what the government's able to do given a very high budget deficit, all set against the background of a stronger dollar. But at the end of the day, I don't mind admitting, I'm surprised how weak India is relative to the emerging market universe as a whole.
Yeah. Thank you for those inputs, Jeff. Jeff Dennis there. Always a pleasure to speak with you. Stay strong, stay safe in that lockdown in California. We're, of course, bringing you the news and updates here on the show from Mumbai, speaking to people in Delhi. Let me go across to Pranab Sen as we try to make sense of what's going around and what's going on. Dr. Sen, the question at hand is, how do we prepare for the economic impact? It would be difficult to say how many people will eventually be affected in India, how many seriously, how our healthcare systems will deal with all of that, and I will tackle that ahead on the show. But I think it's safe to say that the economic impact is here. Already in a situation where the economy wasn't doing too well. We were in the middle of a slowdown when this pandemic fear has hit. What do you think those in government should be doing right now?
Well, let me first begin by trying to outline the nature of the problem as I see it in India. We are, I think, significantly different from the United States in that ours is largely a rural economy, unlike the US, which is largely urban. So the issue of containment takes on a completely different dimension here. So let's talk about the two parts of it and try and sort of sketch out what the scenario will look like. So we've got a situation at the moment where it is essentially still an urban phenomenon, and that's where it's starting to happen. But even within the urban area, there is, I think, a very clear distinction between the formal sector and the informal. I don't think people realize the extent to which we depend upon the informal for our necessities. If you look at the example of the SARS, which happened about 2 decades back, nearly, more people died from the lack of essentials than from the disease itself. Now, in the Indian context, where your entire wholesale and retail system is in the informal sector, where people are living hand to mouth, day to day, if there is a breakdown at that level, COVID may actually be the lesser of the two evils. So I suspect that the informal sector will continue, which means, that has a very direct corollary, which means that COVID-19 will spread very, very fast. The real fear is if this spread triggers off a fresh wave of panic. At the moment, the panic is primarily limited to the upper tiers and upper echelons of our urban society. If it percolates down and people do what they did during demonetization, which is go back to the villages, then we are looking at a completely unmanageable situation. And this is really the big fear. We know what the economic hit is as of now and the big areas. So it's essentially the trade, tourism, hospitality industry. It is essentially all industries which are dependent upon imports and industries which are dependent upon exports. These are the sectors which are the first line of damage. The second line of damage is really what happens if the panic grips the informal sector. Then all bets are off. It's practically impossible to predict. But let me be very clear on this, that we are, as a country, we are really looking at a trade-off between infection and death and lack of essentials and death. That is the trade-off, and that's the trade-off that the government will have to think about very carefully. Now, let me go back to what we had discussed about a lot of countries going in with massive stimulus packages. That's something that is important, because what it does, in effect, it enables people to stay home and buy things they need. But if the things that they need are not available because the supply chain has broken down, then pumping in money isn't going to help you at all. So it's critically important that the government focuses on keeping supply chains intact. I have not heard anything on this so far. I'm not even sure that the government is cognizant of it.
Well, some very important points and an alarming picture there really emerging. There is no doubt that we need to act with alacrity. Here we're still waiting for the Apex Bank to come up with rate cuts, but the train may have moved ahead. Dr. Shukla, I just want you to weigh in on this very serious discussion we're having, because we're already seeing the impact, in a sense, of social distancing, right? So you've had to shut down businesses. The Restaurant Association, for example, has asked its members to shut down. Small businesses, as a precautionary measure, are shutting down. Not everyone can, have people working from home and continue to pay them. Of course, the informal labor supply, etc. Do you think there is time to start thinking about something like a universal basic income? Something which first appeared in an economic survey several years ago. Do you think we need to start thinking about those kind of subsidies so that people can at least keep buying essentials?
Well, I think, Tamanna, a very important point was made in terms of nature of the problem. And if you look at the Indian economy, the sheer informality is huge. I mean, there are, and the other dimension, if you look at it from a supply side, services economy contributes about 50 odd %, and that complicates the picture. So the first instinct for the government should be for this to contain this disruption from becoming a massive destruction of the economy. You have seen governments act with alacrity, and I think if there is one lesson that we have learned from the global financial crisis and what we are seeing again in the United States is that we have to act fast and act big. And you're right that there are governments that are contemplating something like a UBI, and because we have such a big informal sector and a large part of our services is also informal, we need to put money into pockets of the middle class and the informal sector. We have to think of, and this also depends, like Dr. Virmani mentioned, we don't know the length and the intensity of the crisis, but looking at how it is played out in certain countries, I think this is going to be more than a quarter phenomenon which government, people and the businesses are thinking about, and therefore I think we need to have a mix of monetary and fiscal responses. The first line of defense has to be the monetary policy. About 30 countries have cut rates already as we speak in this year. I mean, from Feb to March, about 30 central banks have cut rates. Now, this does not directly cure or address the virus issue, but what it does is it provides a backstop in terms of liquidity and some kind of assurance. The other part is the fiscal policy, where I think it is very, very important that the government starts to think about how can it put some money into pockets. They can look at postponing or giving some kind of leeways in terms of postponing some of these payments, be it your PF and some of these mandatory payments that go to the government, some bit of forbearance, and also both the fiscal and the monetary policies standing by to do whatever it takes. And let me make one more important point. I think in this whole thing about the coronavirus, we must understand that health is a state subject, which complicates a lot of problems. Whatever policy failures or issues that you see typically happen in sectors which fall in these domains where the center or the state cannot act. So I think how the state governments also really react is going to be very, very critical. And the amount or the size of the fiscal stimulus or the monetary stimulus does not matter. What matters is how quickly you can reach the people who need it. You need to reach out to families or households. You need to reach out to firms that are in distress. As long as you are able to do that, I think we should be able to manage this problem before it gets out of hand. So I'll just reiterate the point that I made. The lesson that we have learned is we need to act fast and we need to act big. We need to have a coordinated policy response, fiscal, monetary, and also get the center and the state to come together to fight this.
So where has that center state meeting taken place so far? Dr. Virmani, I want you to come in on some of these points. Here just to very, clearly and fairly look at the measures so far. The Indian government's measures in terms of locking down borders fairly early ahead of the curve have been lauded. But let's look a bit at the economic response. Has a clear center state meeting taken place so far? Is the central bank waiting too long to do something like cut rates? And of course, they announced open market operations today. A lot of other things have been happening. But what are we really waiting for?
So let me tell you, I handled the 2008 crisis as CA. I dealt with the BOP crisis before that and several minor crises. I was in the finance ministry. So what is it? The general point, of course, is absolutely correct about monetary and fiscal policy. But let me tell you what is the difference when you are in a crisis. You cannot only use general fiscal policy measures. One of the key things you learn in handling a crisis is that you have to direct fiscal relief, whether it's for welfare or economic purposes, you have to direct it at the critical points in the system. Now, given that the direct effect we know is in travel, tourism, and what I call the contact sectors of the economy, you have to look at those sectors first. You have to identify where there is failure and distress, and you have to target it at those sectors. Now, we know that in a normal time, targeting is very difficult, right? But in a crisis, you cannot worry about it. You have to take measures to identify where these critical people are, and you have to try and direct it at that. You don't bother about big ideas like moral hazard and type 1 and type 2 errors, etc. This is one basic lesson one learns from handling a crisis. The second element, of course, is the part which has been written about all over the world, is the financial transmission of a crisis. Now that we know a lot. We have experiences from all over the world. After I left as CA, I was 3 years in the IMF. All those issues, we have reams of papers were written about it. So, Dr. S is quite right that what you have to do there is to make sure that contagion doesn't happen. Now, at this stage where the crisis is still small, I think RBI has taken the right measures to make sure that short-term, medium-term and long-term liquidity is not reduced due to any kind of occurrence. That is really the first step. The second step is to ensure that interest rates don't flare. For example, today there was a scare that government security interest rates were suddenly jumped up, and the RBI acted immediately to reduce it. So again, the RBI, I know because I dealt with the fiscal monetary coordination in 2008-9, they have enough people who have dealt with these issues. But they have to make sure, and final point, if you want me to stop here, is that the quality of the response of monetary, fiscal and the coordination and the targeting becomes critical when the crisis becomes larger. As I said, at this stage, the broad measures are fine. But if we go another 3 months, 6 months, 12 months into a crisis, this targeted effects or targeted policy becomes much more and more important.
Right. No, so I will ask for you to end that comment. Then thank you, Dr. Virmani. You are always a speaker who thinks about how the show moves on. So thank you for that. The question is, which sectors are really hurting? Because everyone is asking for help. Small retailers are saying, give us a tax break, at least give us some GST relief right now. The real estate sector has been crying for a while. The auto sector is literally banging its head on every door, considering they have a BS6 deadline looming and nothing has happened on that. So we were already in pain. It wasn't like the economy was in this pink, healthy, rosy glow before this has hit. So Pranab Sen, let me bring you to the next question. How long can we really wait till we hit that emergency button, quote unquote, really to give some kind of relief?
You can't wait. Look, the point is hitting the emergency button after the parachute has failed doesn't help anybody. If you have to do something, you have to do it now. You have to be well ahead of the curve, because it's not just the measures that you take, but the confidence that you generate, which is even more important. So to say that I'm going to think this through, I'm going to have any number of committees being set up to examine this issue, and then we will take a reasoned call, I think would simply be making things a lot worse. I think Arvind is absolutely right. When you're in a crisis, you act now. And even if you're wrong, errors can be corrected as you go along. But you have to act now, and you have to be seen to be acting now.
Absolutely. We have to act now. We have to be seen to be acting now. There may be different approaches. We may not all want to helicopter money down like the US is, but we need to start seeing some serious action so that the economy really survives whatever is coming next. Well, the big concern is, can we flatten the curve? That's the new term everyone's talking about. We need to flatten that curve. But before that, we need to figure out whether we have reached the highest point of that, which is the number of cases. When I come back, excellent panel of medical experts. I have with me Kiran Mazumdar-Shaw, I have with me Viren Shetty, I have with me Dr. Ashish Jha, Director of the Harvard Global Health Institute, after this very short break. Don't go away.